So if you haven't downloaded these, do that. All right, so here is your ascending aorta. Here's the aortic arch. And then your descending aorta. And it goes all the way down to the pelvic cavity. What cavity is this? This is the thoracic. Here's the diaphragm. And then this is the abdominal pelvic. So theoretically, we could say that this is the thoracic aorta and abdominal aorta. And I guess it's implied that if you're talking about the aorta, you're talking about descending or away from the heart. All right, so I'm not going to make a real big issue about you saying descending thoracic, descending abdominal. But sometimes it is nice to differentiate, thoracic aorta, abdominal aorta. It's just a little bit more specific. All right, let's look at these vessels then up here that come off the aorta. So the first vessel off the aorta is the brachiocephalic. There is no right and left. I will take points off if you put right or left. There is no right or left. It's just a brachiocephalic trunk. It branches into the, and now this isn't about 70% of the population. There are variations in this organization here. Branches into the right common carotid and the right subclavian. Next branch off the aorta, left common carotid. Next branch off the aorta, left subclavian. That's it. Those are the three major branches. Now you can see, or maybe you can't, I don't know, that the common carotids will branch into the internal and external carotids. And this here is where those baroreceptors are, one of those locations, in the carotid sinuses. Now the internal carotid goes up to the brain. The external carotids stay superficial. They supply stuff into the deeper portions of the neck, and the mandible and maxilla, and eventually that external carotid ends up here on the superficial temporal portion of the cranium called the superficial temporal artery. And I'm not sure if that's on your list or not. Anybody have that list on them? No? Okay. You don't need to know it then. But that's where it does that. All right. Now, the subclavian artery, both on the right side and left side, changes its name once it passes underneath a certain structure. Under which structure will that subclavian artery pass to then become the axillary artery? Subclavian, beneath clavicle. So here's the clavicle. Subclavian passes beneath it. It becomes the axillary artery. Both sides. I'm not going to duplicate on the left side what's already on the right. They're the same. Here's the armpit right in here. Okay, that's the axillary region. And typically right about there, it changes its name again, and that's the brachial artery. That's where we take blood pressure from. That's the common location anyway. And then that brachial branches into the into the radial, on the right side of the right radial, and the ulnar. And then these actually kind of form this anastomosis. The radial and ulnar arteries actually kind of join together. And what we have, and it's not shown here, is we have these branches off of this little circle here. It's called the superficial palmar arch. And these are what supply blood into the digits, these little interdigitary vessels. And this is the same on the other side as well. So on the exam, if I were to ask you to trace the flow of blood from the left ventricle to the thumb on the right side, you'd say, okay, brachiocephalic trunk, right subclavian, right axillary, right brachial, and then the blood could go into the right radial or right ulnar, and eventually into that vessel that leads into the thumb.
Doesn't the ulnar go to the pinky and the radial go to the thumb?
They do, but blood can still continue through this little superficial palmar arch and then into these little things. Yes, typically the blood is going to go this way. But if something were to block up here, that blood would still flow through here and get to those areas. So theoretically, yes, you could get to that thumb through that ulnar side too. But yes, the ulna is on the pinky side. If you want to look at it that way.
Excuse me.
Yeah.
To substantiate, for me, it helps me to remember that there's just the brachiocephalic on the right side. Am I saying that correctly?
It is. It does go to the right, but I don't want you to put right because that indicates that there's a left one too. To me, indicates there's a left one too. If that works for you, fine. I don't care. Just don't put right brachiocephalic on the exam.
Just brachiocephalic.
Lecture or lab, I would suspect you'd get marked off in lab too.
All right.
But yes, it stays kind of on that. It directs things to the right side.
Thank you.
All right. Now, if we follow that descending aorta here, we have these intercostal arteries. These are what supply blood to the, lack of a better term, the meat between the ribs. If you're eating ribs, you're eating those intercostal muscles there. Okay? But that supplies the muscles between the ribs and the ribs themselves with blood. So then that aorta passes through the diaphragm. And then there's several vessels that come off of that aorta. The first one is called the celiac. That has branches which supply the stomach, the liver, and the spleen. You don't need to know those this semester. And then we have one called the inferior mesenteric artery. And that supplies, superior. We do have an inferior, just not there. Superior mesenteric, and that supplies the small intestine. It actually branches off into many little smaller arteries that are found in the mesentery. Remember when you looked at the pig, you looked at the digestive system, you had that white, shiny membrane with the blood vessels in it between the folds of the small intestine? That's the mesentery, and all that stuff is supplied by that superior mesenteric artery. Now, if we keep going, we're going to find a very small artery that supplies the adrenal gland, and that's called the suprarenal. All these are listed on that sheet. Most of them are, at least for the arteries, should be in pretty close to order. And then we have the vessel that supplies blood directly to the kidney, and that is the renal arteries. And then down here, it's not on here, but we have what's called the inferior mesenteric artery. That actually supplies blood to the colon. But actually what happens is that these vessels, the inferior and superior mesenteric, actually meet. They form this little loop. And then there's branches off of these. And then, of course, at the very end of the aorta, we have the common iliacs, right and left. So right and left common iliac. And then it will split into the internal and external iliac. It's not common anymore. There's the internal and the external. The internal goes down deep and supplies the reproductive structures in the urinary bladder and so on. Rectum, things like that, kind of deeper in the pelvic cavity. The external iliac will supply blood into the lower limb. Now, when that external iliac passes through what's called the inguinal ligament, it is no longer external iliac, it is now the femoral artery, or femoral. And I think that's the last artery that you need to know as far as the lower limb is concerned. So I want you to be able to tell me, trace the path of blood. Now, I'm not exactly sure how I'm going to have you do this. I might have you, I might give you a list and say, put these in order. I might give you one artery and say, what are the ones that come next, or what comes before this, what comes after. And I can do it with veins, too. And keep in mind, when you're doing an ordering of arteries, you don't want to go femoral, external iliac, common iliac. To me, the blood would be flowing backwards. Blood doesn't go that way in arteries. blood comes away from the heart in arteries. So it would be common iliac, external iliac, femoral. Veins, it would be the opposite. We're going back to the heart. So we're going to want to name the vessels as we get closer to the heart. Femoral vein, external iliac vein, common iliac vein. Yeah?
The Latin name shows a superior mesenteric